Hello and welcome to this NEET PG 2021 recall video of dermatology. I am Dr. Jazir, a faculty of dermatology, and in this video I would like to discuss about the recent questions that has come in the NEET PG 2021. So let's begin with the questions one by one. The first question is, a truck driver presents with a painless indurated genital ulcer. The motility of the causative organism can be checked by. The options are dark field microscopy, Sang smear, light microscope and fluorescent microscope. So you all know that whenever a patient gets a painless indurated genital ulcer, indurated means there is a raised edge, and we all know that button sign is seen in this type of a painless genital ulcer called syphilis. So in case of a hard chancre or syphilis, the first investigation that we would do is a dark field microscopy. So in a dark field microscopy, we'll be able to see a corkscrew kind of motility of Treponema pallidum. So the right answer for this question is option number A, that is dark field microscopy. So now let's see the second question. A patient on multibacillary multi-drug therapy presented with inflammation of the existing skin lesions and involvement of the nerves. How would you manage the patient? So in the options there were like either stop the multibacillary therapy or continue multibacillary therapy, and then you start with either steroids or thalidomide. So these were the options that were given. So from the question, what do you understand? That a patient is on multibacillary multi-drug therapy, and what has get inflamed? The existing skin lesions got inflamed here, which means it is hinting to a lepra type 1 reaction. So we all know that in type 1 reaction, the existing lesions become inflamed, and in type 2 reaction, there is an erythema nodosum, leprosum kind of a reaction. So in all these cases, be it lepra 1 or lepra 2, since both this lepra reaction is not an adverse drug reaction, we will definitely continue the multibacillary multi-drug therapy. The second is, in both the lepra type of reactions, the drug of choice is steroids. So out of all these options, the right answer would be C, that is continue multibacillary multi-drug therapy and start steroids. So now let's go to the next question. A 30-year-old patient presents with a flaccid bulla over the trunk. The histopathology reveals suprabasal split. Now what is the diagnosis? The options are pemphigus foliaceus, vulgaris, vegetans and erythema multiforme. So this is a young patient and he presents with a flaccid bulla. So flaccid bulla means it is going to be intraepidermal pathology. The second thing is the histopathology reveals a suprabasal split. So we know that out of the intraepidermal pathology, we usually compare pemphigus foliaceus and pemphigus vulgaris. So pemphigus foliaceus is a subcorneal split, whereas in pemphigus vulgaris, it is a suprabasal split. So the right answer here would be pemphigus vulgaris. So that is option B. So now let's go to the next question. A patient presents with dysuria and urethral discharge as shown in the image. Now what is the causative agent? So you can see that what is the type of discharge that is being shown. So you can see that it is not a clear discharge, it is a mucopurulent kind of a discharge. The patient is also complaining of dysuria, means painful micturition. So in such cases, the diagnosis would be urethritis. And what causes most of the symptoms? We divide urethritis into gonococcal urethritis and non-gonococcal urethritis. So if you can recall that non-gonococcal urethritis does not have that much of a disturbing symptom, whereas all these kind of symptoms like dysuria, mucopurulent discharge, all these things are seen with gonococcal urethritis. Now see the options: chlamydia trachomatis, Neisseria gonorrhoeae, Haemophilus ducreyi and urea-plasma urealyticum. So out of all these options, the right answer would be option B, that is Neisseria gonorrhoeae. So now let's see the next question. A female married since 4 years presents with a foul smelling white discharge without itching. Her last previous menstrual period was 2 weeks ago, and what is the likely diagnosis? So options are bacterial vaginosis, trichomoniasis, physiological and vulvovaginal candidiasis. Now, bacterial vaginosis, we all know that it has a fishy odor. That is one. Trichomoniasis is a greenish discharge. Physiological is the option C, and option D is vulvovaginal candidiasis, where we get a curdy white discharge. So just see the question. So there is a little controversy here because some of the students were saying that a foul smelling was not mentioned, and some of them were like foul smelling was mentioned. So in case the question is a foul smelling white discharge without itching, the right answer would be bacterial vaginosis because you get a fishy odor. Whereas if foul smelling was not mentioned in the question, the right answer among all these options would be a physiological discharge. Because in trichomoniasis we may get a greenish discharge, and in vulvovaginal candidiasis we get a curdy white discharge with itching. So this is how you can make out the answer. So now let's go to the next question. A patient presents with paronychia and the lesions over the upper limb as shown in the image. Now which antibiotic is suitable for the treatment? But this image is a little confusing because you can see a erythematous linear kind of a rash over the upper limb. But see, in the question it is mentioned that the patient presents with a paronychia. So we all know that acute paronychia is bacterial and chronic paronychia is fungal. And in the case of paronychia, the most common organism that causes paronychia is Staphylococcus aureus. It can also be caused by Streptococcus. So see the options now: metronidazole, moxiclav, amikacin and norfloxacin. So out of all these options, the one that responds very well to staph infection or streptococcal infection would be a moxiclav. So the right answer here would be moxiclav. So going to the next question. What associated symptoms are seen in the following nutritional deficiency? And an image like this is given where a patient is having a rash around his neck area. So what is this rash called as? This is called as the Casel's necklace. We all know that Casel's necklace is seen in pellagra. So in the case of pellagra, let's see the options now. History of diarrhea and dementia, the history of periorificial dermatitis, alopecia and flaky dermatitis and swelling. So out of all these options, the 4 D's of pellagra that is diarrhea, dermatitis, dementia and death. So the right answer would be option A, that is history of diarrhea and dementia. I think there was one more question that was asked from the same topic, like which is the amino acid deficiency that can be seen in a patient who is predominantly on a maize diet. So the answer was tryptophan. Again, it is coming in the same topic, but since that is not coming under dermatology, I did not add to our questions as well. So now let's see the next question. A child presented with multiple rough surfaced papular lesions over the elbow. Can see the image here. So she also complains of vision disturbances during night. What is the diagnosis? So from this, the options are Phrinoderma keratosis pilaris, lichen planus and lichen nitidus. So among all these options, if you can see these kind of multiple tiny papular lesions with a rough surface over the elbow area, that too in a child. So this is implicating some nutritional deficiency. So in case the child is complaining of a vision problem, probably a vitamin A deficiency. So this condition, as what you see in the image, is called as Phrinoderma, which means there is a toad-like skin. So the right answer would be option A, whereas one of the differential diagnoses would be lichen nitidus, where a patient may again present to you with a similar lesion, but it is not usually associated with any vitamin deficiency. So they would never have mentioned about vision disturbances during night in the case of lichen nitidus. So the right answer here would be option A, that is Phrinoderma. Now let's see the next question. This has been a repeat question for several times, and the question is: a child presents with a boggy swelling of the scalp since several weeks. She is in contact with domestic pets. What is the diagnosis? So you can see that there is a patchy alopecia, there is a boggy swelling, and she is in contact with domestic pets. So this is going to implicate option C, that is chorion, because this is definitely not an epidermal cyst. Epidermal cyst has nothing to do with a contact with a domestic pet. Folliculitis does not present in this way, because in folliculitis we expect a crop of pustules, whereas we don't expect a bogey swelling. So the last one is an abscess. Abscess can be a differential diagnosis, but since a contact with domestic pets has been mentioned, the right answer would be chorion, where the patient would be having a regional lymphadenopathy, easily pluckable hair, and this can also lead to a scarring alopecia. So the answer here is option C, that is chorion. Now let's see the next question. A close contact, I think a nephew of a primi gravida was mentioned in the question. Okay, so a close contact of a primi gravida was diagnosed of chickenpox. Now the close contact has chickenpox, and this is a primi gravida in the question. So the varicella antibody of the primi gravida was negative. So what is the interpretation? So this means that when you do a varicella antibody, it has come negative, means there is no immunity against varicella. So if there is no immunity against varicella, what is the first infection that happens? Is it varicella or is it zoster? The right answer would be zoster. Now let's see the options. She is susceptible to chickenpox. The second option is she is susceptible to herpes zoster. She is immune to chickenpox. She is immune to herpes zoster. So definitely not C and D. And among A and B, the first infection is always chickenpox. So the answer here would be option A, that is she is susceptible to chickenpox. So now let's go to the next one. No. So that's it. So that is all about this discussion. There is almost 10 questions was asked in the NEET PG 2021. So, and all these questions was easily doable, I guess, because we did not have much of a surprise. So I hope the exam went well, and I'm wishing you all the very best for your results as well. Thank you so much.